30 seconds, the pendulum will drop far enough to touch your body. Within 60 seconds, it will cut you in half. All you have to do is destroy the things that have killed your hands.
Wait a minute, what would you do?
What would you do?
It just slices through the top of the abdomen. You have to deal with slowly bleeding out, and you have to also worry about infection. But if you get deeper, if you rupture your abdominal aorta, you're gonna bleed out super fast.
You must insert your hands and push the buttons to start the devices for you. Your bones will be
if you get your hands cut off, you have arterial bleeding, but it's a smaller blood vessel, so it'll take a little bit longer period of time, and it's a lot easier for you to get bandages to them. Obviously, it's kind of hard with nubs, so to speak. Save yourself, man, let's go. See, he's trying to get out of it. What do you think? No, not gonna work. Oh my gosh, I'm getting nauseous. How long would it actually take for somebody to die of these injuries? It depends on how much blood is actually pouring out of your body. Some people have lost blood over a very slow period of time and the body's been able to compensate.
I ain't got time to bleed.
Versus in an acute injury where you just pull out blood. Like thinking about this from a realistic standpoint. Go, man. Go, 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 go. Oh, it's slow. A lot of the red stuff, the hands, they're getting crush injuries. A lot of times crush injuries don't bleed that much. They ooze out because you're not actually slicing, you're actually just crushing the tissue. But until it gets even deeper, will you have that significant amount of bleed. Now this gentleman is quite skinny, so he doesn't have a lot of adipose tissue or fat underneath his skin. You have a higher chance of definitely hitting major blood vessels. In the abdominal wall, you're actually worried about some blood vessels that are kind of on the side of your six-pack, so to speak.
Here is your first test.
Oh, it's got a CPAP machine on or a BiPAP. That's actually a pretty good mask. Typically we use that type of mask in somebody in the hospital who has sleep apnea, or say they have bad CHF, congestive heart failure, to where they have fluid in their lungs and they can't breathe.
He's got fluid.
Your health and hereditary background put you in the highest category of success. The same cannot be said for your adversary.
Oh.
Well, only 52 years of age. This man has continued to smoke even though he has a history of high blood pressure.
We actually do use it in people who have bad COPD, chronic obstructive pulmonary disease, which is a combination of chronic bronchitis and emphysema. And it's due to people smoking. Sometimes it can be a hereditary deficiency as well.
This demonstrates very little appreciation for the blessings of his own life. Your game will focus on a simple element.
So it's interesting that he calls it a game. This almost reminds me of Squid Game, that show on Netflix where they have to do different things between life and death.
Once this game begins, every time you take a breath, the clamps around your chest will close in and crush your body. The only escape is in the other's failure.
What? In a situation where you're freaking out and your adrenaline is up, you're gonna breathe faster because your cardiovascular system is working hard because you're anxious. To be able to try to slow down your breathing, you gotta get into a Zen place, and I don't know how you can get into a Zen place in this situation.
You're messing with my Zen thing, man.
Oh, big breath. Oh, no. Oh. So very common when people get very nervous, scared, they'll urinate themselves. It has to do with the muscular control of the sphincters relating to the bladder itself. In this situation, the person died immediately. Could that really have happened? If you have such an injury to the heart itself where you rupture one of the ventricles, yes, you're going to die very, very quickly because you're going to pull blood out. You're going to be unconscious first. If it doesn't get fixed, you're going to die.
I want to play a game. It's right before your eyes.
Oh no. He put the key behind his eye. I want to know how he's got surgical skills to be able to do that. There's a lot of muscles in the way of that. How is it actually just resting behind there? We don't have that much room and extra pockets to put things. Oh, don't pull the device. Oh my gosh, he pulled nothing works well out of aggression.
Until you learn to master your rage.
Your rage will become your master?
Oh my gosh, he's got a scalpel. It looks like it's either a 15 or a 10 blade. it's so hard to do. My one suggestion would not be to cut through your cornea, because the cornea is the highly sensitive area of the eye, which is basically the clear coating over top of your iris and your pupil. Super painful if you touch it. So I'd go to the white area where there's less nerves. You couldn't do it. Oh, man.
That's a shame.
Could you do it? You can injure the eyeball itself, get all the fluid out, squish it, move it out of the way. The other thing you potentially do, cut here at the side, but the issue ends up being you have all the muscles and the optic nerve that are keeping the eye in place. So those have to be cut. Oh, geez. Why is she like, was she like given something? Maybe she's waking up. Oh, there's a syringe with yellow something in it. The only stuff that's yellow is TPN or a banana bag. TPN is what we give people who can't eat, different electrolytes and nutrients in there. Then there's a banana bag, which is very similar. It's like a multivitamin that makes it that color. Oh! Oh no! Oops, and now her hand is caught. No, don't put two hands in. If she had just one hand in there, she could at least lift the blades out of the way, but now both hands are going to be stuck. Oh no, yep. Yeah, oh my gosh. So a lot of times we'll have people who do have wounds like this or superficial wounds that we just have to sew up. Really easy to sew these lacerations back together unless they're deeper to where you have tendon injury or a major vessel. Sometimes you can actually injure a nerve.
Whoa! What the is that?
Whoa.
It's the tool. The tool that's going to save your life.
The tool that I use in the emergency department that saves the most amount of lives, the quickest, is probably the defibrillator. And then obviously the staff there is an instrument in itself. Without them, we wouldn't be able to save lives.
As a drug addict and a thief, you preyed on the kindness of others to fuel your addiction.
A lot of people suffer from substance-related issues. We have resources to help people, but you can't force anybody to help themselves. We'll help guide, but I can't actually set that up for you.
You just lean forward into the knives with your face. Press hard enough,
Oh gosh.
and you'll release the arm or leg restraints that bind you.
Your temporal artery sits right here in the temporal area. Feel like that would get sliced right open. It's a small blood vessel. You can hold pressure to it once you're through this. Sometimes arteries have to be put back together by a very skilled and trained vascular surgeon or trauma surgeon can do it.
You can sit idly and bleed out on the floor. Live or die, Cecil.
You're gonna go in and out of consciousness. You're gonna become delirious from not being able to sleep. You can not eat for many days, but you need hydration. Your body's gonna start shutting down even if you don't bleed out.
The timer expires. The door in front of you will be locked forever. Just one hint as to where that key is.
Oh, no, not good. You gotta use some sort of protection. Literally at work, whenever we're finished with the needle, it has to go into a sharps container so that way it's not just left in the trash by accident, left on the counter and you don't know. Like as a physician myself, any needle that I use, I literally make sure that I put that away.
It will be like finding a needle in a haystack. Let the game begin.
If the needle still has some blood in it, you can actually inoculate somebody else or inject it by accident, and there could be bloodborne pathogens that might be transmitted that way, like hepatitis B and C, and then obviously HIV. Oh! 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 Ah! Ouch. It made it sound like it was like glass, but all of those syringes are probably plastic, but the needles themselves are potentially all metal. Ow! What's wrong with you? She found the key? How the heck did that happen? Oh my gosh, yeah. You had enough time to put the key in and you screwed up. Oh my gosh. You idiot! I know some people are terrified of needles. I've seen many people pass out in the hospital from needle sticks, but I always tell them, don't worry, this is the best place to actually pass out if you're gonna pass out.
Safest place in the world to be.
Hello, gentlemen. You came looking for the game. Congratulations. You found it.
Oh,
You were
found the
final
game.
two players.
Never good when there's a weird contraption around your neck, especially with like this weird breathy voice coming over the loudspeaker. It is literally like the seat collar from hell.
Can't be. You may recognize the device around your collar, Dr. Nelson.
Dr. Nelson.
These laser cutters slice through tissue and bone.
Oh, laser cutters. We don't get to use those in the emergency department. You gotta be probably really careful with them. They might be attached to robotic arms or something that's super stable versus these free-form devices.
You both have an opportunity to live. All you need to do is confess. It's that easy.
Oh my gosh, oh my gosh. I wonder if those lasers can actually cut through other material outside of flesh. Why wouldn't it be burning a hole through the ceiling as it just went up?
I confess.
Yeah.
Okay, all right.
Oh.
All right, John Kramer, it was me. It was me. I messed up your x-rays.
Oh, he was doctor that messed up the x-ray. Sometimes doctors actually do mess up. They're human beings and they either dictate or write something in the wrong chart or leave something out. They might have missed something. These things do happen.
I should have been there for you. I wasn't.
Oh, I was expecting his face to be cut like a cake where it was into pieces, right? How quickly could somebody succumb to these injuries? Just all depends on how quickly the blood is leaving the body.
The device you're wearing is hooked into your upper and lower jaws. When the timer in the back goes off, your mouth will be permanently ripped open. Think of it like a reverse bear trap.
Oh, I've never seen any bear trap injuries in the emergency departments that I work, but I bet they do occur in areas where hunting would go on. I work more in an urban setting, so the likelihood is a lot lower.
There is only one key to open the device. It's in the stomach of your dead cellmate.
Oh, what? Oh, no, don't freak out. Okay, you got the lock. Remember, if anything is attached to your head, don't just like rip, turn around. You don't know if it starts things, okay? Oh, he's not dead. I wonder if he was given certain medications to keep him from being able to move, or was he paralyzed from the neck down because he was opening his eyes. Big, huge scalpel to the abdomen. I definitely wouldn't be chopping that way. If you're gonna cut the abdomen open, you want smooth stroke like what they do in surgery. And then just do a layer by layer, get in there, move tissue around, spread it open so then you can get to wherever this might be. Oh, she got lucky. Is it ripping your face off, but is your airway still intact? Rip all the way through to where it messes with the spinal cord in the back. Depends on where the fulcrums are and all that stuff. I hope I never find myself in a situation where I would even have to deal with that.
The human body is a miraculous creation. Ever wonder how far the arm can twist?
Oh my gosh, for twisting? It looks like it's screwed into the hands and the feet. So you can actually go between the bones of your hands without fracturing. We see injuries where people accidentally get a nail and the bones are actually fine. It squirts right through.
Are you willing
Have mercy.
to take a bullet for the man who killed your son?
Whoa. Oh! Rotating, that is so painful. When we have somebody who dislocates their shoulder, we'll actually do external rotation of the shoulder. It's hard to get it all the way to 90 degrees. Now you're actually rotating in this direction even further. Ouch. Ouch. Oh, so it's held in place. It looks like it's rotating at the elbow. We're made to rotate like this. It's called pronation and supination. It's made to do that, but not to great extremes. Oh, the leg. Oh, the leg. Oh my gosh. Oh, no. 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 We don't see too many rotary type injuries. Typically, there'll probably be more of a snap of the tibia itself. The patella can go side to side, but that's easily fixed.
The device you are wearing is hooked into your rib cage. By the time this tape is finished, you will have 1 minute to find a way out.
You got hooks or barbs stuck onto the ribs. We actually do procedures where we cut open the chest and lift the rib cage off.
There is a single key this, Cary. It is right in front of you. All you have to do is reach in and take it. But do it quickly. The acid will dissolve the key in a matter of seconds.
There's a bunch of different acids that we always worry about. Hydrofluoric acid, hydrochloric acid, bad pHs that will burn tissue. Oh! You can still actually live for a little while with the ribcage gone.
She's gone!
It's a protective layer. When you fracture and break off all those ribs, you're gonna have some bleeding. So it causes a lot of pain. Are you going to die right away? No, actually. So that one's very, very interesting.
Once her device begins to rotate, it will pierce her eyes and mouth. Step into the other machine and lift the bars to the highest position, long enough to close the circuit, slowing down her device.
So rotate to enucleate.
Nuclear.
Gouge the eyes out. But then on the opposite side of the eyes, you got your brain. If it penetrates deep enough into the brain in certain areas, it may not be sustainable with life. Oh, every time he lifts it, he's gonna get punctured into the abdomen. Oh my gosh! If you're getting impaled in the abdomen, going through the different muscle layers, and then you have omentum that sits right underneath the abdominal wall muscles, which is like a fatty layering over top of your organs. Oh man. Oh my gosh, see how they're actually cut? They're actually beveled. Beveled just like any type of needles that we use when it comes to IVs that are hollow like that. One end is like a point and then it's like a cup, but it's sharp all the way around, and it just has to do with getting into tissue a lot better. Oh, goodbye. Pain in your eye would be of like the cornea, which is the clear cells that are over top of the colored parts of your eyes. Super sensitive to painful stimuli. And I've never seen that type of impaled type injury to someone's face. I don't know if it would be like a fountain of blood like that. Obviously there'll be some blood, but there was a lot of extra red stuff, if you know what I mean. Ooh. All these like contraptions, just having previous experience discussing medieval and dark age type contraptions, these are just as bad or even worse. Fluid. Is he gonna drown him? Is it just water? Yeah. Somebody can hold their breath for 30 seconds to a minute. It's different for every individual, and it changes from being in a calm situation where you're holding your breath now to where you're kind of freaking out, increasing your oxygen more to your tissue. So you actually really need to calm down. Obviously, so much harder than me just saying it. Trying to use a knife or a pen to try to break the glass. Oh my gosh, holy cow. So, wasn't expecting that. He takes out this pen and does his own crike. He's putting it below the Adam's apple. You want to pop right in.
Pop, pop, pop.
To your trachea, below your vocal cords, and you can start breathing. That's pretty impressive. Wow. I don't know if anybody's tried to breathe through a straw. It's actually kind of hard. When we intubate somebody at the hospital where we put a breathing tube in, we actually try to use the largest we can. Typically try to get an 8 French in there. So a good sized tube.
One who has given the most flesh will release their bindings, while the gears on your opponent's head will engage, piercing their skull. Who will offer the most flesh?
Offer the most amount of flesh?
A pound of flesh.
Fingers and tissue and arms and oh my gosh. Oh my gosh, the screws in the head. Awful. That is actually your temple area. When somebody actually needs a halo for cervical immobilization, that's kind of an area where they actually do it. Ouch, but these are like rusty old screws. Holy cow, get to cutting some tissue off. Oh, he's cutting his own skin. Oh my gosh. Did you know that the skin is the largest organ of our body? Oh, tourniquet. Oh, using a tourniquet. This is like the ones we use at the hospital. A little bit of blood flow to pump up the veins so you can engorge the veins so you have an easy shot to get an IV or get blood drawn. And then you actually take it off once you actually get in the vessel. So you're probably going to be using this to decrease the blood flow to chop off our own arm. Cutting off a finger, that's hard. You're not gonna be able to cut through. Oh my gosh, they're doing it by weight. That guy has such an advantage because of the adipose tissue or the fat tissues that he has. But it is painful. The girl has to worry about bleeding out. I don't know if that tourniquet's going to be tight enough. It needs to be super tight to stop the flow 100%, and it actually is quite painful, but probably not as painful as missing a limb. There you go. In this circumstance where it was amputated, you definitely have a higher chance of having something called phantom limb syndrome, where you still actually think that the limb is there. Hopefully, in this circumstance, if she gets out, maybe she can keep her limb, and because it was such a clean wound, you might be able to reattach it. Hopefully that weighs enough. Things that we see when people come to the emergency department when they actually have an amputation, typically it's not a smooth cut like that. Typically it's all broken tissue, bones are all in pieces, and it's just one big mess.
It's a mess!
Whoa. Screws going that far in, again, causing bleeding into the brain. Would it actually cause you to die right away? Probably unlikely, but it will make you die quickly, but not that fast.
Make the simple blood sacrifice that I've requested.
Oh, Nelly. Whoa. Looking at the blades, they are probably 3 to 4 inches maybe in depth. That's going to potentially go into your thoracic cavity where it could actually sever part of the lung, sever basically part of your heart. Oi! So, laceration to the forearm. Obviously, we're going to get an x-ray if that comes into the emergency department. We'll get the bleeding to stop.
I just don't know how to make them stop.
Because it's on the forearm, we typically will actually use lidocaine with epinephrine. The epinephrine will actually constrict the blood vessels, so you have anesthesia for a lot longer.
Cut yourself! You need to cut yourself! If you want blood, and then you're free!
You can take off your own finger. Oh, wow. When we see people who come into the emergency department with all these lacerations, typically they'll actually go to a certain part in the emergency department where it's more like a fast track. All you need to do is make sure the bone's not injured, maybe an x-ray, make sure there's no foreign bodies, and then have the wound looked at, anesthetized, cleaned out really well with water. Depending on how deep it is, you may need to do multiple layered closures, or do you just need to be able to bring the tissue back together? Typically in the emergency department, we do simple interrupted sutures where it's one individual with multiple knots, depending on the size of the suture.
Help! Hey, help! Help, please!
Oh, what is this contraption? Those look like really bad optometry lenses when you go to see the eye doctor and you do the, is it better now? Is it better now? That's like a scary version of that.
All you have to do is click the dial across the 5 positions,
All right,
and
we
you will
gotta...
live to see another day. You have 60 seconds.
I don't know exactly what's on his fingers. They actually almost look like these things called finger traps that we use in the emergency department that actually go over top your fingers and hold your hand in place, that we use if somebody has like a fracture. Oh, wow. Hyperextends the finger, probably fractures it and dislocates it. Just do it all super fast. Suction? Did they just suck his eyeball out? The amount of force that that takes, that it's able to tear the 6 muscles and the optic nerve and the blood vessels all out all at the same time. I'm not sure how it actually happens. What? Oh my gosh. What? Holy cow. I was not ready for that.
Oh my goodness.
Horrible, awful. Have I actually seen somebody's eyeball totally out? Actually, no. I've seen a lot of traumatic injuries to the eyeball itself where there's lacerations, there's blood coming out, but not being suction tubed out of there.
Attached to your arms are 2 explosive devices.
Whoa.
The blades cannot cut through the galvanized cable, but they can slice through flesh and muscle.
having to actually cut yourself with these, the first incision will hurt for about a second, and then after a few cuts, it won't be as bad.
Considerably.
It's hard to see exactly how deep having to cut into the tissue, but it's into the forearms, right? You're cutting through soft tissue, you're cutting through the nerves. You can hit major blood vessels. They're deep inside. They typically will run kind of closer to the bones, so they're protected. Okay, he conquered this. Could he bleed out? If a major artery in the forearm is lacerated and you don't get control of the bleeding by compressing it, holding pressure to it, could you bleed out a lot? Yes, but would it make you die? It's hard to know. Your blood pressure will eventually slow down, so the amount that is forcefully coming out will actually start to slow. Concerned the injury there would be perforated eardrums, tinnitus, ringing in the ears, almost like concussive type forces, as well as potentially hemothorax or pneumothorax relating to injuries to the chest itself.
There are more than 5 pounds of marrow in the human body. All you need is 3 ounces.
Talking about bone marrow, where your precursor cells for all your blood cells are, within the meshwork within the bones.
There's more than enough in your femur. Just suction it out. It'll be transferred to that device right there.
We'll do bone marrow biopsies in your hip, and a lot of times we'll use bone marrow to help somebody who needs a bone marrow transplant when their cells are potentially cancerous and they're not functioning the way that they should.
Wrap it under your legs.
Oh, so she has to amputate off her own leg using a bone cutting saw, which I've actually used. You just want to do it fast and quick and with a lot of force. Woo! There you go. Oh my gosh, she was able to cut her own leg off. So now the issue is your femoral artery is bleeding, your veins of the leg are bleeding. You potentially can bleed out pretty fast, so you need to get moving.
You're running out of time.
So this looks like one of those suction devices at the dental office. Sorry, a dentist out there. We have similar suction devices. Our suction devices are plastic, so we can be thrown out. That's messed up. Come on. Come on. When your head is removed from the rest of your body and no more connection, the question ends up being is how long is the head still conscious? And there's no way to specifically tell this. They've thought it back in the day where there was some eye movement and maybe there was some awareness. Unlikely.
Less than 3 minutes. The enzymes.
3 minutes to cut off your own skull?
A circuit. This will save your life.
So you gotta make sure you don't cut the wrong piece of brain out that has to do with motor function. Oh my gosh! Oh my gosh, that gave me like the heebie-jeebies. That drill bit is only about 1 inch long, maybe a little less. Might not hit the brain tissue, but you're gonna cause brain bleeding, you're gonna cause pain because of the meninges, which is the covering of the brain. But once you get through that, the brain itself is actually insensate. Does not have pain receptors. So it is kind of soft, kind of gelatinous, weird feeling. Yes, I felt someone's brain before because I deal with traumas. So it could look like that and have that same kind of texture.
Hello, Gabriella. I want to play a game.
No, stop it.
Just watching these clips gives me like stress. If you guys are in situations where you're more stressed than you want to be, definitely check out a product that I've helped put together called Chillax. It's mood stabilizing and helps with healthy stress management.
Radiation machines are not to be trifled with.
Radiation exposure, cellular breakdown. So we use radiation therapy in medicine to help target tumors, cancer cells, to shrink them down, to try to basically kill the cells themselves. Gonna try to like break the bone out. Look at it, skin, flesh melting. It's like a hammer. Awful.
That's awful.
Obviously, in this situation, she's just happy to be alive. You need to get to the hospital. The priority is getting the joint back into place because it significantly reduces the risk of long-term arthritis to that joint the faster you can get the joint back in. Oh! A hot cup of coffee spilled right into your crotch.
And hot.
That skin in between, you know where, is like super sensitive, super thin. Can get first degree, second degree, even third degree burns. Oh no. Oh my gosh. That individual has no chance at that point. I don't care if you have airbags or a seatbelt. We all know this. You don't need to be a doctor to figure this out. Oh, gentleman slammed right into a tree, thinking severing your spinal cord because of the amount of force that you land into a hard, and then your bike comes in again going, 40 to 60 miles an hour, right either in your legs or the abdomen. It just depends on where it hits you. With this car flipping, we actually see a lot of people that actually fly out of the car. And so when EMS gets on scene, we always ask, where was the individual found in relationship to their vehicle? Were they tossed from it? Did they just get out of it? Oh my gosh, still alive, simple injuries, scratches, you're wearing the seatbelt. Obviously, everybody wears a seatbelt. The airbags might have not been in. They might have not deployed because of not as much frontal injury. Oh my gosh. Like, these are the worst luck ever. We do see people that come in after a car has been on fire. You do worry about not only just like burns, but the materials that are burning. So you always worry about like potentially cyanide poisoning. The SUV slamming into the tree again, flipping over. Survivable? Yes. EMS will probably put you on a backboard, put you in a seat collar. Oh my gosh. Holy cow. Okay. A water bottle getting stuck underneath the brake. It's not unrealistic. So just be careful what you have in the car and, keep any obstructions away from the driver's side at least. Oh no.
Way too warm in here now, huh?
Tanning bed. Huh? Tanning beds, no good, okay? They increase your exposure to UV radiation, which then increases your risk for skin cancer, melanoma, as well as aging of your skin, thinning of your skin. Oh my gosh, melting. Oh, it's getting shattered. The glass is shattering, so you worry about like simple lacerations. Likelihood that you're going to lacerate a major artery is probably pretty low because most arteries are quite protected by where they are anatomically in our body. Oh my gosh, beautiful. I was not ready for that. This is awful. Really, there's not much to do at this point. You have melting of your airway potentially as you breathe in the flames. You're having the fire itself taking the oxygen away from you in that area, so you're becoming hypoxic. So you have a double whammy. That's so much. Oh, I see what's happening. He's going to drown. He's panicking, which then is going to decrease the ability for him to hold his breath, and he's going to run out of oxygen quick. Stop it. I have literally seen where somebody's rectum prolapses, aka comes out.
Put her back in.
Like literally involutes the other way. So it looks like this big sausagey looking thing, and it's very tender, it's painful. There's a nerve endings, it could bleed. What? I don't know anything about pools except going in them is fun and hanging out with your friends, but could it actually do that to somebody? That's crazy.
I can't move my head.
Perfect. Just what we want. Here comes the drop.
Okay, so device so you don't move your head. I'm assuming this is like an ophthalmologist putting drops in the eye.
And you will feel a little numbness.
Numbness drops. So we typically use either tetracaine or proparacaine. All the meds that end in cane pretty much are the anesthetics. So lidocaine, bupivacaine.
Relax.
Oh my God, the ominous music. Don't tell your patient to relax. It's really an inappropriate word. It's really hard to relax when somebody's sticking metal in your eye.
Is that supposed to be happening?
Where's the doc? Typically, a ophthalmologist would do this potential laser therapies. A lot of times when somebody is in these type of devices, they're doing other therapies by hand versus the machine. Somebody needs to be manning the machine, somebody needs to be around. Slow, man, oh my gosh, oh my gosh. I'm not an eye surgeon, not for me. Wow, look at that. It's like cutting through regular flesh and tissue. Watching these movies, they definitely get you worked up, excited. My company, Life Happens. We have chillax for those occasional stresses. And then we have Do Not Disturb, so you can turn your brain off at night.
What? What is it, Norm? Wait.
Those hooks are prosthesis for individuals that obviously don't have an arm, and the hooks help grab. That's why those are there. Oh! Oh no. Oh my gosh. Could blood come out of your mouth? Because we know that is the view that we all get in movies, shows. In this circumstance, it actually could work in the sense of crushing an airway, crushing the neck. Oh. Oh my gosh. What would you do if that happened in real life? Decapitation. You lose the connection of the brain to the body, so heart and lung function will cease because there's no more information. You still have oxygenated blood in your brain, but is there consciousness? That is a $1 million question, and really nobody knows the answer to it. The likelihood is no. What the heck is happening? Metal straps. We don't use that type of stuff at the hospital, but we do use restraints. The reason for this is protecting a patient potentially against themselves and that patient against staff members due to being altered, confused, having severe psychosis. This is definitely giving me like Chuck E. Cheese versus Saw vibes. We got these blades that are flying in different directions, coming at your face. You're gonna lose soft tissue, and then the question ends up being, is it strong enough or not to cut through bone? Will it kill you, so to speak? It needs to get into the major vasculature of your neck or destroy pieces of your brain. Oh, not good. Oh, yeah. When I see saw injuries in the emergency department, we typically see missing digits. That's probably the most common. Sometimes just soft tissue injury like lacerations, usually hands or forearms. And then the occasional ones where we end up seeing scalp injuries. Oh! Kid's got a hook caused the laceration to the left forearm. Obviously, you can go through soft tissue. You also worry about the extensors of the forearm itself. What we'll do is we'll ask you to extend your wrist, make sure it's intact, check your fingers, make sure that everything gets extended appropriately. What? That's freaky. Things that we see coming out of people's eyeballs is typically either blood. You can actually have like bloody tears. The other thing that we actually also see, purulent discharge. So purulent discharge meaning like pus coming out. That could be related to multiple different types of infections, which could be pretty bad. They look creepy. Oh my gosh, it's eating its face. It's gonna be extremely painful.
It would be extremely painful.
There are a lot of nerves to your face. Is it enough destruction to actually kill you? Or are you gonna be permanently disfigured, choking on your own blood, filling your own airway with blood and swallowing the blood, which then is gonna cause you to vomit because blood makes you nauseous. You gotta get a big bite. Oh! person just get severed in half. We see a lot of machinery injuries. Most of the time it's extremities at a big factory. Please bring pieces with you as best you can. That way we can at least look and see if there's a possibility of reattachment. Oh, get the kids again.
Stay away from my sister!
Oh, are they using their own fingers to do this? Come on, this can't be real.
Come on!
Oh. You have all these lacerations. Make sure your tetanus shot is up to date. And then the question ends up being, do you need to have antibiotics or not? Is it dirty, rusty? Does it increase the risk of infection? Oi! Nope, not just fingers. You got blades. Blade to the back of the leg. You think about the Achilles tendon or any tendon attachments behind the knee. They're going to hurt a lot more than just soft tissue because you might actually be ruining the connective part of the joint to making that area useless because then you can't actually use it. Ah, he's in his own head. Definitely having a weird psychosis event happening. Oh, geez. Talk about being calm and collected under stress. Sometimes when we're so stressed out, our adrenaline's kicked up and we can't focus enough and we can't have good, fine motor control of our extremities. Obviously in the hospital, people do pass away. We don't just leave them. We put them in a body bag. Get him a body bag! And get them to the morgue. Every hospital has a morgue, a place to store the deceased until their bodies are claimed and people take them. You got one where the face is like destroyed, but then there's one where the eyeballs look like they're out. There's some blood there. Is there a lot of blood in the eyes? Not really. There's blood vessels in the back of the eye, maybe surrounding the eye, but not the eye itself. It's mostly fluid. Ooh, new character. Is that a cupcake? Looks like a cupcake. Maybe it is a cupcake. All right, we got him. He's limping. He must have injured himself. Hopefully, he's got enough adrenaline to keep him going. That's typically what's happening in this situation. You have epinephrine, you have norepinephrine, or we call it adrenaline or noradrenaline. It's like the fight or flight situation. Oh. What is happening? Oh, got him. Biting on him. We see people who come to the emergency department who have been bitten by cats and dogs. The tissue is destroyed. We have to get x-rays to make sure the bone's not been punctured. If it has been, then we worry about osteomyelitis, and then you might need to be on antibiotics, not just for like 10 days, but more like 6 weeks. Oh, whoa, 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 causing electrocution. Wow. Obviously, we see electrocution injuries. You can get burns, you can get muscle breakdown, and then we always worry about cardiovascular aspects, making sure that your heart doesn't have an arrhythmia, that you're not at risk for any cardiac arrest. Cardiac arrest! Whoa. They're rebelling. Okay, thank goodness he got a suit on. Oh, the spring lock failure. Oi. Oh! Piece of it is impaled into probably the abdomen. Puncture wound to the abdomen. Depends what it potentially hits. Could be soft tissue, could be intestines. You might have poop free flowing within the abdomen, which if untreated over probably a couple days will lead to sepsis and then could potentially kill you. Wow. It's gonna be a lot of bleeding, a lot of pain. People say, oh, you'll get into shock. Jimmy's going into shock. It's gonna take a long time in this situation to develop shock to where you're not gonna feel the pain. Oh, man. Ow. If you get stabbed or punctured in the back, it literally depends on the location, right? So if you're getting mid-thoracic area, higher thoracic, so you worry about puncturing the lung, as well as if it's on the midline or just off midline, you're always worried about hitting your heart, your esophagus, the trachea. What is that? Oh, a chainsaw. Chainsaws initially were potentially used in medicine. Obviously, we don't use these type of saws. We do use saws, very specific saws that are very fine to make the finest cuts. Now this person's trying to grab behind and get it off, but it's a hook. Unless you're able to lift yourself off, you're kind of stuck. And it looks like more on the right side of the back, so it's more likely that it punctured the lung and you're being held up by your own ribs. A chainsaw that is made to cut probably wood and trees, it's going to cause a lot of destruction to the tissue. I do see these type of injuries that come to the emergency department where people are cutting trees, either the chainsaw kicks or it falls and it hits the individual. We see a lot of destructive tissue. It looks like it's been chewed up, really hard to put back together, but we do our best to put it back together. Sometimes you need to debride the tissue, meaning you actually have to cut some tissue away to get a better wound closure and better future healing. And then obviously these are dirty, they have oil in them, you'll have to worry about infections. She's being pulled by her hair.
They pull your hair up.
Which hurts like heck. The hair can be ripped out. There could actually be bleeding that is caused from a lot of hair being ripped out. And then obviously you always worry about cervical spine issues, ligamentous issues, and any tendon or muscle issues relating to that area. Typical fight type injuries. Somebody hitting their head against the wall, somebody being carried. You're gonna get ecchymosis. You're gonna get bruising. You're gonna get some hematomas. Unlikely from a fall from a standing position and hitting your head will you actually cause a skull fracture or intracranial bleeding. This depends on how much dead weight you are. Oh, the gentleman's hands are tied together and now he's hanging from the chandelier. That in itself is going to cause difficulty with breathing, so hard to expand your lungs. And then if you're hanging for a way too long a period of time, there also is an issue of the shoulder joint. So if somebody's already previously dislocated their shoulder, they can actually dislocate their shoulder again. You're stuck. Oh my god. Oh my gosh. Chainsaw to the groin. That's going to cause so much pain that you could potentially pass out. Going to cause some bleeding, but not a lot of bleeding to cause death within 10 seconds. Oh my gosh. What the? Oh my god. That is a big chainsaw. Holy cow. Typically sparks would mean something is hot. The biggest thing I think about is actually getting in your eye. So we see a lot of people in the auto mechanic world get small pieces of metal get into their eye. It can cause irritation. It can cause a rust ring. It can cause corneal abrasions or lacerations or even puncture into the globe. I always wondered how easy it would be to chainsaw through the roof of a car. I'm pretty sure it's hard to do, right? Because of like the jaws of life and the different devices that fire departments use. They have a saw to cut through metal. It does take a little while. This roof looks more like a convertible roof, so it's probably super easy. Oh, but it was a mask?
My mask!
Oh no. So that wound by a chainsaw actually looked really clean. Typically it wouldn't look that clean. It'd be jagged. The saw would probably be bouncing because the skull and the bone is actually quite hard. Most of the chainsaw injuries that I've seen that actually have hit somebody's head, I've seen scalping,
and I want my scalps.
The tissue being cut off. I've seen a fracture, but I've never actually seen it go all the way through the skull. But that's why you wear safety glasses. That's why you wear a hard hat. Things to protect yourself in situations that injuries are common. Oh my gosh. Holy cow. Okay. Definitely not compatible with life.
Stench.
If that much brain tissue is totally gone. The bleeding wouldn't actually squirt like that. It would just pool out. You have some major arteries that run around, and then you also have pooling sinuses that are in there. Oh my gosh. Go, go, go. Oh, what? Some part of the plane just nails this individual. Looks like there's massive amount of head injury. You'd probably expect a little bit more trauma to the head, maybe more skull fractures, more bleeding, and potential brain matter. If it's a significant traumatic brain injury, you can not have a massive skull fracture and still have bleeding within your brain that makes you unconscious and then slowly will potentially kill you. So he's got this unique bionic looking brace to his right lower extremity. So there could be an issue relating to the leg itself. Does it not work? Was there a previous injury to the knee? Multiple different things could occur. A lot of people get sciatica, or what we call a lumbar radiculopathy, where there's a nerve compression to the lower back.
My back
Affects the legs. There are multiple different apparatuses that we're coming up with now that could potentially mimic something like this. I'm so confused.
What is happening?
The experience of watching a loved one pass away, this is actually quite normal, and it does happen where there's a whole slew of different emotional experiences that an individual might experience. Depends on if it's expected or not. If it's right away, it's quite traumatic. If it is something that's expected, it may not be as traumatic, but it's still just as emotional. Oh, Jason Voorhees in the building. Oh, okay, wait a minute. A lot of times people smash their face on the ground or a wall and their skin just splits right open. The trauma of the tissue hitting a hard surface actually causes it to break and split apart. Then obviously you're worried about skull fractures and getting concussions and cause some bruising. The first things I think about, whiplash injuries.
I think I got whiplash.
Then we actually see people who get their hair ripped out. I've never seen somebody manually get their hair pulled out as well as the scalp. Typically there's some other trauma to where the hair then would lift off. I was drowning her. Oh, what is that? Oh, liquid nitrogen! Holy cow, that was super cool. That could actually happen.
You don't know it could happen.
It definitely does not make the sound of shattered glass. People actually do come to the hospital with traumatic injuries to their face, and you can just put a tube right in there and you can oxygenate the person, and obviously it's going to need multiple reconstructive surgeries. Oh, look at it. Oh, look, this is the table of like joy for just this type of person. None of these are potentially medical tools that I would use in the emergency department, except for maybe there's this one little one. It almost looks like an ear curettage, basically where we would take earwax out of someone's ear. Some weird, creepy doll. Freddy Krugger comes to you in your dream. Sleep stages have to do with our own brain waves. It allows us to have these potential subconscious thoughts. Sometimes people remember them more vividly than others. It spans a whole spectrum of what dreams and nightmares could actually mean, just causing nasty lacerations. Freddy Krugger, his whole body has scar tissues, and you see those like really thick lines. And what happens over time, they actually get tighter and tighter. Then is a plastic surgeon or burn surgeon can change the direction of it and then reattach it, and it actually expands the tissue again. Oh, what? That is so cool and interesting that they would actually depict things like that. He's pulling out his blood vessels. The blood vessels are intact and he's using them to tie him up. Just like that puppet doll, he's gonna probably dangle him, I'm assuming. Yep. Yep. Oh my gosh. The blood vessels in our body are a little stringy because they're made up of muscle. A lot of times if a blood vessel is actually cut due to trauma, they actually retract. So you actually have to try to go find them. You obviously probably have more bleeding than was actually occurring because of the other vessels that are around there, the small capillaries that are cut versus these big major blood vessels. We've talked about falling. If you fall from a height that's 3 times your height, it's a major trauma. 3rd story, 2nd story. This is like way up there. Major increased risk of death when you fall from such a height, especially depending on what you're falling on. Oh, we got blood. I don't know why this lady's freaking out or being weird and looking like she's possessed, but maybe she's in shock and our bodies do weird things when that occurs. Sometimes people are like a deer in headlights and they can't move. Lady falls to the ground. Oh, we got shoes. We got some pants. We got a knife. Yes, we got Michael Myers. Oh. So multiple puncture wounds, probably through the back torso area. Gonna go into your lungs, most likely. Your heart is protected in the middle, and in the back, you have all your vertebrae that are in the way, as well as the ribs. Oh, we got Scream. Nice. Breaking through the glass, when we're dealing with that in real life, we actually see people who have lots of lacerations. Sometimes you can't get all the glass out, which isn't a big deal. People literally will freak out. The body will actually figure out a way to work it out, and then it'll come right out.
Then they come out here.
And a stab wound to the abdomen, guaranteed, right? No? Oh, into the chest. Stab wound to the chest, you have your sternum, and then you have all the little lumps that you can feel where the ribs hit. So if you hit the bone, it ain't going very far. But anytime there's a potential wound like that, we're gonna get x-rays, a CT scan of the chest, as well as get a 3D view of what's going on there. Strangulation injuries. The biggest things that we worry about are actually injuries to the intima, the walls of the blood vessels in your neck. Sometimes you can complain of like a headache or discomfort in your neck, and we'll actually do what's called a CT angiogram of the major blood vessels of your neck, just to make sure that we're not missing tears or new formed spaces that can form in that area. Oh, you stabbed her again. I can't tell because it's dark. Just by the way, the sound, it's definitely probably neck. Classic sound that you would hear having airway compromise. Injuries to the neck. We worry about the zone 2 area where you have these major blood vessels, jugular vein and your carotid artery.
It's up.
Chucky's put together by Staples. We'll use staples on the scalp, but we won't use them on people's faces. We don't want to potentially increase the risk of having scars next to the scar that's already formed. Have you guys ever had staples placed? Let me know in the comments. Oh my gosh, I was not ready for that. The amount of strength and maybe how strong that wire is, I don't conceive that that could happen. We don't deal with very many decapitations that come to the emergency department because it's not survivable. The things you worry about, obviously, are you bleeding out, the spinal cord injury, and the fact that you don't have a head on top of your body that communicates to it anymore. And wait, what am I watching? So now this other doll looking thing just urinated itself. Sometimes animals, cats, dogs, when they're super excited, they can't hold in their pee and then just let it go by accident. Or in humans, when you're super scared, you'll potentially urinate or defecate. Oh geez, that's gotta be Jason. Oh! Come on.
Come on!
Punch straight through the back. Not a wound that we see in the emergency department. The extraordinary amount of strength that would take. We see back injuries.
My back!
Spinous process injuries. You have transverse process injuries, but then you also have vertebral body fractures. Slammed into a tree. If your head hits the tree, you're gonna get significant amount of traumatic brain injury, intracranial bleeding, skull fractures, but also potential whiplash of the neck. Oh jeez. Oh, what's happening? Oh, this has got to be Freddy Krugger. Obviously, you would not be able to be under the water like that and hold your breath that long. No, obviously, this is probably a dream.
'Twas a dream.
Yep, I knew it. His burned skin has that appearance. When people get burns, they have these ropey scars, and it just has to do with the scarring of our tissue. You really have to keep it hydrated with a lot of different types of ointments and lotions and a lot of stretching. Typically, when you're fighting, you can't hold your breath as long because you're using so much energy. If you're calm and relaxed and you can slow your body's activity down, you can hold your breath a lot longer. Freddy Krugger has this glove that has just got blades on it, potentially either had a laceration or a stab wound. If it's a laceration to a major blood vessel, you're going to bleed out in basically 30 seconds to a couple minutes. If you have a puncture wound, it's going to take a lot longer, unless it's a puncture wound to your heart or to your aorta. Wow. Look at the water, it turns red really fast. Blood in water just gets so dilute and it just looks like a massive amount of bleeding, but it's actually not as much as you think.
Joey.
Treating people who've had near drownings, you're looking at your lungs, the heart, and making sure they're both functioning appropriately. A lot of times there's fluid in the lungs that are in the way of gas exchange. So when you put somebody on the ventilator, you're actually causing positive pressure into the lungs. So it's manually forcing the water out. Oh, Halloween. Michael Myers. Oh, geez. Oh, the noise. Typically, Michael Myers always uses a big, huge kitchen knife. So I'm assuming big, huge kitchen knife to the abdomen. What major structures do you have to worry about? Most of it is just intestines. It's your omentum, which covers the intestines. And then behind that is major blood vessels in the spine. Electrocution injuries, it depends basically on the amount of energy. Obviously, this looks like a lot. You're having flex contractions. Typically, that is AC current that's causing that. Whoa. Foaming of the mouth, I think, is more for dramatic effects. Typically, you see foaming of the mouth if somebody is really dry. You're water hungry. You see that a lot with rabies. Come on! Come on!
Come on!
No. What actually happens, why you die from electrocution? Typically, it's a cardiac arrest. You're burning your nerves, you're burning the tissue, you're causing rhabdomyolysis. If there's enough energy, could something explode? Maybe, but I've never seen it, nor would you come to the emergency department because you're dead. Oh, jeez. Oh, I knew it was Scream. Those blonde tips, that's what gave it away. Oh, jeez. Right to the neck. Oh, right side of the neck. What structures do you worry about? The carotid and the jugular. Your internal jugular vein is basically a big blood vessel that sits more superficial to the skin, and behind it is your artery, and the carotid artery sits there pumping tons of blood. The fact that blood is coming out of his mouth makes absolutely no sense.
That don't make no sense.
Because that blade is actually not anywhere close to the oral pharynx, to the trachea, to the esophagus. Come on. Come on. Scream, people. You guys need me to help you advise what would actually happen. This color of the blood is super dark. Venous blood is quite dark, but it's not that crazy dark. That wound could even miss the major blood vessels there. It could actually go lateral to them, lateral meaning to the outside. I'm kind of disappointed.
Disappointed!
You'd have to go more midline and then go on a lateral angle to have that go out where it is. To feel someone's pulse, you have to push on this part of the neck. If you have your trachea, it's going directly laterally to it over on this side. What the heck is this? It's Chucky! Oh my gosh, that little rag doll. He's got all these lacerations that are healed and stitched together. Obviously, if a human had a laceration to their face, you want to stitch them together using about a 6.0 to 7.0 size nylon type of material, and you only want it in the face for about 5 days. Oh, we got some chemicals. Oh, a sulfuric acid. Obviously, it's going to cause some burning. Ow. Melt it away. Yep, there we go. Whoa, intense. Typically, if you have an acid that's causing injuries, you need to try to neutralize it or get a base on there.
Just to get a base.
If this happens, we actually call poison control to give advice of exactly what to do, because there's toxicologists there 24/7. If you ever need to call poison control and you're in the United States, it's 1-800-222-1222. Treatment for most acid burns is just irrigation with water for 15 to 30 minutes. Get rid of anything that's contaminant and a lot of water, and then get to the hospital ASAP. Oh my God, he's taking photos.
Say cheese.
Could it actually kill somebody? If I guess there was enough of a dose, high enough potency, and it eroded through major blood vessels, then yes. But that amount of soft tissue injury just to the face would not actually kill you. Who is your favorite scary movie character? I want to know. I hope you guys took away some educational components and what to do in the future if any of these type of injuries cross your path. What the heck? Whoa! Why do I got a leg that looks like it's been off the body for a while? Perfect edges, it's not bleeding anymore. It's a little bit of bruising to it. We don't see these type of cuts in the emergency department very often. It's much more like jagged, ripped. If it is cut like that though, the chances of reattachment are actually a lot higher. She's pulled up by the hair. Depending on the strength of the tissue, could be fine. Could also pull some of the connective tissue underneath the scalp and pull that off, and you can cause a hematoma underneath, just depending on what layer. Oh! Is this what is that? It's like a wood chipper? Stop it. I have seen different type of machine type grinding injuries where a finger or a hand gets caught in and gets ripped off. You really can't put back together. It's gone. So you just need to cut off the end of it, seal it back up, and then have a prosthesis in the future, unfortunately. This is awful. The middle of the abdomen and the torso are not in there yet, but yet there's blood coming from the mouth. To get blood coming out of the mouth, either the blood from your stomach, maybe the intestines or the esophagus are coming up and you're vomiting it out, or you're having blood coming from your lungs and you're coughing it out. Oh, breaking through. Breaking through a concrete wall. That would probably hurt. Not to mention Santa Claus coming down. I was waiting for Santa Claus to get impaled rectally. Oh, good shot.
Santa?
Whoa. Going straight through the dorsal part of the hand, could fracture straight through the bones, the metacarpals, or could actually go in between and just cause blood vessel and muscular problems, as well as puncture through the skin. Oh, somebody passed out. Quite common. This is what we call a vasovagal event. Something stressful can cause them to vagal down, meaning the blood pressure starts dropping. If you do get up too fast, you're going to pass right back out again. Oh my gosh! Passed out and impaled through the spinal cord, through the bone, straight down the middle. Come on.
Come on!
Could that kill you immediately? Probably not likely. Even if it severs your spinal cord right at the base of your skull, you're still going to be alive for a short period of time. Oh, let me just get some... What is that, vodka?
What are you doing?
Oh my gosh! Has anybody smelled burned hair? It smells awful. It has to do with the sulfur, I believe.
Sulfur!
When you get that type of burn around, you're going to get burns to your skin. You're potentially going to inhale the fumes. Head trauma like this, just because of the mechanism, will place you in a hard collar. Yes, they're quite uncomfortable, but a hard seat collar, just to make sure no more damage might get done if there is a fracture. You're looking for fractures of the skulls, lacerations, as well as any bleeding inside. What is that? Is that eggnog or something? Drowning, you can drown in any depth of water. Even that might cause a shock to where you might actually close your vocal cords, but most of the time it's probably causing issue relating to breathing. Oh! That leg was solid as a rock. Solid as a rock. You see the blunt trauma causing the laceration. It actually kind of splits open. Easy to fix. They bleed a lot. Numbing medicine, typically we'll use lidocaine with epinephrine, which will actually help constrict the blood vessels, decrease the bleeding. Ouch, right in the back. My back. Soft tissue, most likely. It's not going to go that deep. The amount of tissue that's in your back is really deep, even on skinny people. When you're looking at the spinous processes of somebody's back, they're at least an inch plus in distance, so there is distance there. Whoa, whoa. What is happening? Oh! What? What? Took out the eyeball. Look how round and perfect that is. The eyeball is got fibrous tissue obviously around it, but then it's just filled with fluid, a gusher. You also have 6 muscles that connect to the back, plus blood vessels, as well as a optic nerve that sits in the back. So a lot of different connections. Oh my gosh, she's like so in the eyes. This eyeball has different types of connective tissue to it. Quite impressive to actually see that. Hard to tell if all of them are there, but you definitely see some white fibrous things, which could be the tendon, it could be the fascia. Is the likelihood that that eyeball would make it all the way through to the back? No. Run, lady, run the other way. Oh. No spinal cord injury, but asphyxiation, not being able to breathe, decreased blood flow to the brain. And just making sure somebody has died. Anytime we get people who come into the emergency department with traumas to the head, neck, and face, we're gonna get CT scans. That's our initial move. We gotta get pictures to see what's going on. Please do not hit each other. Please do not cause more trauma. Please be kind to one another.
Be excellent to each other.
Merry Christmas, Frank.
Oh! What? I don't think that's a real Santa. Causing suffocation. Suffocation! Not being able to breathe. We typically see injuries when people are trying to hurt somebody else by strangulation. Most of the time it does not happen. You just see a lot of bruising. If you have an injury to the blood vessels of the neck, it increases the risk of having a stroke or dissecting through and causing more trauma. What's he doing now? Wait a minute. Laceration to the neck from, I'm assuming, ear to ear.
He slit his throat from ear to ear.
Where's all the blood? Literally have seen this injury before. You have to go pretty deep to lacerate the jugular vein or the carotid artery, which typically sits even deeper.
I'm warning you.
Oh! What? What kind of injury is that? Do we see the back end of it through the back of his head? We do not. Where is the rest of the axe? Is this a common injury that we see in the emergency department? No, but oral trauma is. Most lacerations in the mouth can actually heal on their own without having to be sutured.